Hello everyone. Another week has gone by and vaccination is still the #1 discussion item. I want to try to clarify how the vaccines are being given out in the county. Each week the state receives about 70,000 doses from the federal government, and each week about 15,000 doses come to the county as a whole, and of that the county health department has gotten 5,500 doses this week and last week, for example. The state sends the doses out to the local health departments and to hospitals, and recently they've begun to send some to pharmacies as well. The Federal Centers for Disease Control, the CDC, developed priorities for the order in which people should get vaccines. The governor laid out priorities for the distribution of these vaccines, and he also listed who was eligible for vaccine. Not everyone who is eligible can be vaccinated soon. The county has been asked to prioritize vaccination of 75 and older, which is what we are doing. The vast majority of our weekly doses are going to the 75 plus group and frontline health workers and public safety personnel, all in the first priority. However, that is not a large number of doses each week. We have about 5,000 doses this week for the 75 plus population. That numbers somewhere around 75,000 people. The hospitals in the county have a total of about 6,500 doses this week. We do not control how they use their doses, but we're asking them to prioritize the 75 plus group and education staff as well. Safeway, Giant, and Rite Aid received doses from the state this week, but we have no information on how they are vaccinating people and what their priorities are. These priority groups include more than 100,000 people for about 11,500 doses. And if you add the other people who are eligible but not priority, it is more than 200,000 people for the same 11,500 doses. You can see why people are confused and frustrated. We also have set aside 100 doses for child care providers, and the county has been asked to vaccinate independent living facilities where the state is unable to do so. We do not have enough vaccines even for our priority groups. The state does not have enough vaccine either. So we have to prioritize within the priority groups. For the 75 plus population, we are not doing first come, first serve. We want people to have a more equitable chance to get vaccine. We're prioritizing the vaccine for populations that have been hardest hit and have the greatest risk of exposure, but they will not be the only ones who get the appointments. I understand how hard this is and confusing. It would be great to have an appointment, even if it were 4 weeks from now. But we can't do that because we don't know how many doses we will get each week. We are working with the state to see what's possible. In the meantime, be sure to pre-register on this site on the county webpage. We hope the county and the federal government get more vaccines and that perhaps vaccines will be approved in the coming weeks and months, but we won't have solutions in the next few weeks. We know that. So please bear with us. Know that when we get the vaccines, we're getting them into people's arms. The county health department could vaccinate 20 to 25,000 people a week if we had the vaccines. And please continue to avoid gatherings. Wash hands frequently and wear a mask, please. We need to make sure that we are as safe as possible until we are all vaccinated. We will defeat this virus. It's just going to take some time. We've hung in here a long time. Let's hang in here a while longer. Thank you.